I get asked all the time, which antidepressant is the best? What's up guys, it's me, ThePsychNPDavidC. There's not really a best antidepressant, but there's definitely some that are better than others. So in this video, I'm gonna give you my full tier list on 15 of the most commonly used antidepressants. I'm gonna rank them based on things such as like their overall usefulness, their side effects, how much they cost, and just the general pros and cons of each one. Let's talk about it. This video is meant for educational purposes only and is not meant to be medical or career advice. So I'm going to go through these antidepressants in alphabetical order based on the generic name. So first we have bupropion or Wellbutrin. It's an antidepressant that's actually purely used for depression. Like a lot of other antidepressants are used for both depression and anxiety, but Wellbutrin is used like purely for depression. One of its major side effects is actually increased anxiety since it kind of like activates your body so much. Like it'll give you a boost in energy, a boost in concentration. So it's really useful for someone who only suffers from depression and not anxiety. Wellbutrin also doesn't have the sexual side effects of many other antidepressants. There's also a lot of off-label uses that it's good for as well. Like it's used off-label for ADHD because it helps you concentrate. It's used off-label for weight loss because it's supposed to be giving you more energy. And it's also used off-label for smoking cessation. So if I ever have a patient who's just like depressed and they have like no anxiety at all, I will just put them on Wellbutrin because it's so good and effective. So yeah, starting off strong, I put Wellbutrin in S tier for sure. And next up, we have citalopram or Celexa. So this medication is kind of like an older version of escitalopram or Lexapro, which we'll get into later. They basically do the same thing, but Celexa just has more side effects. One of the main side effects of Celexa is that it can mess with your heart rhythm. That side effect isn't common in most other antidepressants. I also read in a textbook that escitalopram or Lexapro is like just strictly better than citalopram or Celexa. So there's like literally no point in using Celexa at all. And I found that in my practice, that's actually pretty true. I've never used it like ever. So I'm actually gonna put citalopram or Celexa in D tier. There's like really no point in using it at all. And then next up, we have despenlaxafine or Pristiq. So Pristiq is an SNRI, but it's not as commonly used since it's a lot more expensive than the other SNRIs. Insurance companies are a lot less likely to cover Pristiq than the other SNRIs. It's used in pretty niche situations, like maybe someone's unable to tolerate the side effects of the other SNRIs, so you kind of just want to try Pristiq to see how they react to it. But yeah, basically it's like too expensive to use most of the time. So for those reasons, I'm gonna put it in C tier. Like there's some use for it sometimes, but it's incredibly niche and often too expensive. And next up we have duloxetine or Symbalta. Now this is one of the other SNRIs that I was talking about. This one is good in the sense that it actually helps a lot with chronic pain. Like if someone has like chronic neuropathy or just like chronic lower back pain or whatever, then Symbalta is a really good choice of an antidepressant because you're essentially helping the patient with their depression and their pain, so it's like a twofer. But one major side effect about SNRIs is that it actually increases blood pressure, so that's what you gotta watch out for. But if my patient's blood pressure is good and they have like chronic pain and depression, then I'll likely choose Symbalta, so that's pretty good. So for those reasons, I'm gonna put it in A tier. If a patient has depression and pain, my mind literally goes straight to Symbalta. And next up, we have escitalopram or Lexapro. So this is the newer version of Celexa that I was talking about earlier. This one is less likely to have the side effect of like messing up somebody's heart rhythm. It's very tolerable in most patients. It's actually one of my first go-to antidepressants for that reason. It's good for both depression and anxiety, like it's FDA approved for major depressive disorder and generalized anxiety disorder. It's one of the antidepressants that has the least amount of drug interactions. So if I have a patient that's taking like 10,000 other meds, then Lexapro is probably a good choice for them. And for those reasons, I'm going to put Lexapro in S tier. It's literally one of my first two antidepressants that I go to for someone with depression and anxiety. The other one is going to be mentioned later on. And next up, we have esketamine or Spravato. So this one is different in that it's not a pill. It's actually like a nasal spray. So you have to go in person to a clinic and have your provider monitor you for like a couple hours after you sprayed up your nose. because it can do things like lower your blood pressure and like cause disassociation. But from my experience, the patients who have tried it, it's actually worked like really well for them. But yeah, you have to go in person to the clinic at least once or twice a week. You have to stay there for a couple hours so they can monitor any side effects. And you can't drive to and from the clinic because of those side effects. So you have to have somebody drop you off and pick you up every time you go. So even though I've seen a really high success rate in my patients, the amount of hassle someone has to go through just brings it down a couple tiers. So I'm actually going to put Spravato in B tier. Like, it works really well, but you have to commit so much time. And next up we have fluoxetine or Prozac. So Prozac is an SSRI that's known for having a very long half-life. Basically, that means the drug stays in your system for a longer time than other drugs do. So this is really good for people who like forget to take their medications. Their body still has like a lot left over of Prozac remaining in their body due to their previous doses. So missing one dose isn't really a big deal. You're less likely to get like withdrawal symptoms. It's also the only FDA-approved antidepressant to treat bulimia, and it's also FDA-approved to treat bipolar depression when combined with an antipsychotic called Zyprexa. So Prozac has a lot of these like specific situations in which it's like really useful. So it's kind of like situational first line for me, and for that reason, I'm gonna put it in A tier. And then next up, we have fluvoxamine or Luvox. So even though Luvox is an antidepressant, it has a very niche indication of being used to treat OCD. So honestly, Luvox, I don't really even use it to treat depression. I only use it as like first line treatment for somebody who's suffering from OCD. And for that reason, I'm gonna put it in C tier. And next up, we have mirtazapine or Remeron. So this antidepressant is known for its two major side effects of drowsiness and increased appetite. So if I have a patient who's depressed and they're not eating or they're underweight and they're not sleeping due to their depression, if they have those two symptoms due to the depression, then Remeron is like really good. And for those reasons, I'm putting Remeron in B tier. It's very good when a patient has those two specific symptoms due to their depression. And then next up, we have paroxetine or Paxil. This is the SSRI with like the most side effects. It has pretty bad withdrawal symptoms if you stop taking it all of a sudden. I kind of just try it if like nothing else has worked. There's just too many side effects and withdrawal symptoms. And for those reasons, I'm going to put it in D tier. And next up is sertraline or Zoloft. Zoloft is a very tolerable antidepressant that's good at like everything. It's good for like depression, anxiety, social anxiety, panic disorder, PTSD, OCD. It has so many different indications. So this is one of my top 2 first-line antidepressants along with Lexapro. Honestly, you can't really go wrong with either Zoloft or Lexapro as somebody's first antidepressant. Like, they're both effective, they're both tolerable, they're both pretty cheap. But yeah, Zoloft is my most prescribed antidepressant by far. And for those reasons, Zoloft goes in S tier. And then next up, we have Trazodone or Deserel. Even though Trazodone is considered an antidepressant, it's actually used a lot more often to treat insomnia. Like for me personally, I've never used Trazodone to treat somebody's depression. I only use Trazodone as needed for someone to help them sleep. So for that reason, I'm gonna put it in B tier. It's one of my most commonly prescribed medications to help my patients sleep, but I pretty much like never use it to treat actual depression or anxiety. And next up, we have venlafaxine or Effexor. So this one is an SNRI. And again, with SNRIs, we have the risk of increased blood pressure. So basically, if one of my patients doesn't respond to an SSRI, like Zoloft or Lexapro, then Effexor would be my second line treatment, assuming that patient doesn't have blood pressure issues. It's FDA approved for things like major depressive disorder, generalized anxiety disorder, social anxiety disorder, panic disorder. So it actually covers a pretty wide range of indications, but the risk of increased blood pressure prevents it from being S tier. So I'm actually gonna put Effexor in A tier. It's a very good second line treatment option. And then next up, we have vilazodone or Viibryd. This one's not very commonly used. It's more on the expensive side and a lot of insurance companies don't cover it. It has to be taken with food. It's supposed to have less sexual side effects than other antidepressants, but the fact that it's so expensive and you need to take it with food drops it down pretty low for me. So I'm gonna put Viibryd in C tier. And last up, we have Vortioxetine or Trintellix. Trintellix is a newer antidepressant that's supposed to be really good for like concentration and like memory and like processing speed and executive function. So if I have a patient who's depressed and one of their main concerns is concentration, I would consider Trintellix as one of my first-line treatments. Now keep in mind, if their concentration issues are due to like ADHD or anxiety or insomnia, then Trintellix is not going to help with that. It's supposed to help with concentration issues due to depression. And for those reasons, I'm gonna put Trintellix in B tier. Basically, I only consider it if I have a depressed patient who's like really complaining of like concentration and memory issues. And that wraps it up for my antidepressant tier list. Remember, this is just my opinion, so if you don't agree, don't flame me in the comments. Or if you do, try to do it respectfully at least. So do you agree or disagree? Let me know in the comments down below. If you found this video helpful, make sure to like and subscribe. I do videos on Psych and P stuff and just general Psych stuff. I am also on TikTok and Instagram as well, if you want to follow me over there at ThePsychNPDavidC. I do medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.